Hello, everyone. Here we are again now. So we're in it. We have cases, we have unfortunate circumstances with people passing away, and a lot of people sick. So some of the questions that I'm getting are questions about where are we on the curve? Are we on the peak? Are we still to hit the curve? This is a very difficult question to answer because it depends on so many variables. And one of the variables that we have to work with is how many tests are done. And due to all the difficulties with the testing in Ontario, that's kind of out of our control, I guess, that we can't really predict accurately. But if we just took a time sequence from other countries and looked at where we would be, technically at this time, from our first case to now, we probably are, and hopefully we're not on this curve, we're probably around here somewhere. And we haven't hit our peak yet. Most likely we will probably hit it in the next week or two. So it's really, really important for us to continue to do the things that we've done in the past. So what have we been doing so far for the past almost 2-3 weeks now? We have been socially distancing ourselves and have been self-isolating if we're sick. I believe that this is actually working. And it's so encouraging when I'm in the community to see that everybody's in their homes. There's hardly anybody on the streets. So many of us are actually taking this so seriously. It is so impressive. It's amazing. Thank you for doing that. What did we do in the past when we had this kind of an infection? Remember, this is called a novel virus. In other words, we've never seen it before. It's kind of a weird thing that's kind of happened, and especially in this wet market. That's what has been assumed. But what did we do before when we had such kind of a virus or a bacteria that we knew of and how to treat it? So we would use medicines, for example, medicines such as antibiotics or antivirals that would essentially kill the virus or the bacteria or help our bodies kill the virus or the bacteria. I would term this something as a chemical warfare. We are at war with this virus, technically. The second modality that we would employ when we fight a virus or a bacteria are biological weapons. Our biological weapons are essentially immunizations, for example. So there's many different types of immunizations, but these are highly effective against some of the most virulent or most toxic type of bacteria that exist on the earth today. Because this is such a novel virus, it is difficult to know how to engage this virus because we don't have any medicines to engage in chemical warfare, and we don't have any vaccinations to engage in biological warfare against this particular virus. So what do we have left to do? Do we have any other weapons that are just as powerful to help us get out of this crisis? So how do we deal with a novel coronavirus or a novel virus that we have in the world today? Well, we need to go back and understand what it is that's a prime directive for every living organism on this earth. And the prime directive essentially is replicating itself. So how can we then engage that? How can we fight against that? And what would that kind of look like? In this portion of discussion, I want to present something that I call a psychological warfare against the virus. It's a term that I just kind of made up, but it's a way for us to think about what we are doing and why it is so important in what we're accomplishing today against the virus. Once again, what does that psychological warfare look like towards this virus? We can't scare it to death. That's just not possible. We can't communicate with it. That's not possible. But what we can do is attack it at its prime directive. It's needing to replicate itself, to continue itself on and on and on as it continues to ravage the world. And guess what, folks? The most powerful weapon that we have right now is the physical distancing and self-isolation. What does that mean as a weapon of warfare? We're denying the virus the ability to replicate itself. By socially distancing ourselves, we are making sure that virus does not have another host to jump into. And when it doesn't have another host to jump into, and your body clears it, or if you never get it, it never has an opportunity to continue its progress. So now is not the time for us to give up. Now is the time for us to continue with our social distancing and self-isolation, because we need to get beyond this crisis. And the only way we can is to deny this virus the ability to replicate itself. So there's a lot of information here. So to summarize, we're probably coming close to the peak at this stage, but we still have great opportunity to continue to flatten that curve. Yes, there are people in hospital and there's some really, really sad stories. And however, we know that something is working because of social distancing and self-isolation that people are doing. In our community here, people are doing a great job. I know that as I'm driving around. It's been amazing how people have taken this so seriously. So folks, I just want you to continue doing what you're doing because it is helping. And I really, really want to thank you for what you're doing, because together we're going to be able to end this crisis. Together we're going to be able to decrease the number of people who are going to be sick or even die. Thank you.